Hello, everybody. It's Dr. Mark Suter again. Just wanted to wish you a happy Tuesday and happy Fat Tuesday. No black eye today, so I hope you enjoyed my explanation from last week on how do you manage treating the traumatic accident of losing a tooth. So hopefully it was helpful in understanding if that ever happens. Hopefully it never does, but if you're ever witness to something like that, hopefully you have a really better understanding of how to manage a traumatic incident like that. So what we're going to talk about today is equally as important, I think, in dentistry and in our health. You know, one of the things I was trying to set the tone for in the future is trying to give you really great information so that if you have dental questions or topics that you want to know more information about, just send them to me. I'd be happy to forward that information onto you or create a video with that topic. So one of the things we're going to talk about today, our topic for the day, is going to be oral cancer and the importance of oral cancer. What a lot of people don't realize is that really the number one cancer, head and neck cancer in the United States is oral and head and neck cancer. So it goes by a variety of names. Some people call it mouth cancer, some people call it throat cancer, some people call it tonsillar cancer. So the idea is the cancers that can be found kind of above your shoulders, right? So I'm going to talk about how common it is, unfortunately, what the causes are, and most importantly, what are some of the things you can do to really kind of diagnose it and catch it early if it does happen, and what to do about the care of hopefully the prevention of oral cancer. So one of the things that I looked up just today was, you know, there's going to be an estimated 49,000, almost 50,000 cases of head and neck cancer in the United States in 2017. To me, I thought that was really an incredible number, kind of a scary number, really. The causes of oral cancer are really two. You know, the main causes that most people recognize are tobacco use and alcohol use. The obvious problem with tobacco use is that, you know, when someone smokes, the amount of carcinogens and the amount of inflammation and things that are created are really detrimental to the health of our tissue. So actually next week, what I'm going to do is I'm going to talk about tobacco use, e-cigarettes. You know, a lot of people ask me about, are e-cigarettes better for you, worse for you? We're finding out some really interesting things about e-cigarettes. They're a little bit surprising. So, and we're going to talk about dip or intraoral tobacco use. I had an office ask me about covering that topic. So we're going to cover that next week as well, and I think it's a really important thing. So tobacco exposure, alcohol exposure, and then believe it or not, HPV-16. Do you all know HPV is really on the rise in America, and it's really on the rise in younger people. The estimate that I saw is that there are currently 20 million people that are HPV infected. So the concern about that with women is that it increases a woman's chances for cervical cancer, and in men it increases their chances for oropharyngeal cancer, which is kind of the cancer of your throat and the back of your mouth. We'll talk about how we can detect that type of virus if you're concerned about it. So 7% of the cancers that are diagnosed, we really don't know why they happen, you know, which is really the kind of one of the scary things. But like a lot of disease, we know a lot about oral cancer, but the reality is there's some cases where we're really kind of at a loss for how it happened. I've certainly met people who have never smoked, never drank, and they get throat cancer. And it's really, it does make you scratch your head and wonder how that happens. But there are a certain degree of conditions where it just there isn't a precursor. One of the other statistics I saw today was 132 people each day are diagnosed with oral cancer. And here's the most staggering statistic I saw is, do you realize that one person every hour of every day dies of oral cancer? So think about that. Just in the 10 minutes that I'll talk with you today, there'll be 10 people that will unfortunately lose their lives from this kind of condition. So my goal is to try to help you or help anybody that you may know to try to prevent it, try to diagnose it, and then figure out the kinds of things that can be done to treat it successfully. So 80 to 90% of cancers, like most disease, 80 to 90% of cancers, if it's caught early, has a great success. So like any other disease, if you can be proactive, catch it early, you have a great chance of survival and have a lower morbidity, meaning that the complications from that condition are much lower. So the key is diagnosing it early and doing something about it, or really making sure that you're aware of the condition. So we're going to talk about ways that we can diagnose oral cancers. So the best thing you can do is see your dentist or see your hygienist or see someone like me that's a periodontist, oral surgeons, people that really specialize in the health of your mouth and your head and neck. So one of the things that people should have done, at least once a year, is to do a good oral cancer exam. And that oral cancer exam doesn't only include just your mouth. Your hygienist or your dentist, they should check your lymph nodes, which is this area here down your neck. They should really check the health of your thyroid. Kind of this whole area of your neck should be palpated, they call it, where you put your hands in those areas and you feel for abnormalities. And what you want to feel for, just like a breast exam, would be you'd feel for abnormal lumps or bumps. And if things don't feel normal, that would be a time, if you did a self-exam, that would be a time to ask your dentist or your hygienist about that particular area. I've had people come in and ask me about something they feel in their neck like that, and it allows me, if I hadn't seen them for a while, it allows me to give them a better idea of what may be happening. So this part of your head and neck should be examined. Even the back of your head should be examined behind your trapezius muscle, this muscle back here. All around the external part of your face. A lot of people get skin cancer kind of in this area from sun exposure. I've had a lot of patients get ear cancer from a lot of sun if they're golfers or they live in a sunny area. We're kind of prone to getting skin cancers in that part of our outer surface of our head and neck. Intraorally, your dentist or hygienist can also do things where they take their fingers and they kind of feel around your lips. They should feel your tongue. They should actually pull your tongue out and make sure your tongue feels normal. They should take their finger and check the bottom of your mouth. We'll talk about one of the huge high risk areas is if you have anything at the floor of your mouth or on the side of your tongue. Those are the highest risk areas for dangerous cancers. So they should literally take their fingers and feel lightly under your tongue and the floor of your mouth. They'll probably have you say ah and look at your tonsils and the back part of your mouth. So they should look all around the tissue throughout your mouth as well as your tongue. And I know it feels kind of weird, but they should pull your tongue out and feel it, pull it to the side, look at the side of your tongue and make sure that tissue looks really healthy. One great tool that our office invested in years ago is a blue light called a Velscope. So it's SCOPE. So it's Velscope. What this technology does for us is it's a blue light. So if I were to put my finger on this, a illuminated blue light will come out, and it will give me the opportunity to look inside a patient's mouth. This is really meant more intraorally than on your surface of your skin. Dermatologists also have ways to detect something similar on the surface of your skin. But you can place this light around the inner aspect of your mouth and your tongue. And what your hygienist or dentist can look for is when that blue light shines on an area that is potentially worrisome or even cancerous, that light will, when you look through the viewer, when I look through that, it'll look a certain color or it'll look a certain darkness. And what that does is it just heightens your dentist's curiosity about the health of that area. So we don't need to go into the details about what they do to do that, but I would just tell you that blue light is a great way to actually see underneath your skin layer and at the bottom of the skin, kind of at the lowest layer of your tissue, that we just can't see with our eyes. So there's certain types of disease that if I just looked at you looked at your gum, looked at your tongue, I could possibly miss something that could be precancerous. Or if you use this type of blue light technology, there's a couple of different ways to do that. But this company has been very successful and I think is very, very good. So your dentist, a lot of dentists now have that, and you can ask them about using a blue light to detect the health of your mouth. So you can do that. The other thing that I do for my patients is I would test their saliva. And your saliva, believe it or not, can be an indicator as to whether you have HPV or been exposed to the HPV virus. So there's a company called Oral DNA, just like it sounds, Oral DNA, and it's called a salivary diagnostic test. And what that does is your dentist can simply have you rinse with some saline for just about 30 seconds. You take the saline, put the saline back into a little vial, send that off to a laboratory, and they will literally be able to tell us whether you have been exposed to the HPV virus. Really important, especially if you've had any other kinds of cancers. So that's a really great kind of safe way of being able to help people figure out whether they have the possibility of HPV virus. So that's a really important thing to do. In closing, the Oral Cancer Awareness Month is usually in April. So what you may notice is that next month that you kind of see a lot of things about oral cancer. The Oral Cancer Foundation, if you wanted any other information or detailed information, I looked up oralcancerfoundation.org. They've got phenomenal information on oral cancer and the treatment of oral cancer, and a lot of great data related to that. So oralcancerfoundation.org. So here's the key: early detection. Like anything else, the earlier you diagnose it, the better. So like any disease, if you can treat it sooner, the treatment is usually better. It's usually less expensive. The results are almost always better when you treat something earlier. And the reality is it may save your life. So the next time that you see your dentist or your hygienist, I would simply thank them when they do your oral exam and your oral cancer exam. Or if they haven't done it, just simply say, hey, I know it's been a while. Can you make sure to check and make sure that things look nice and healthy, and that I'd like you to, kind of do an updated oral cancer exam. So I hope this was helpful. So next time we get together, we're going to talk about tobacco use, e-cigarettes, and then maybe a little more discussion about the HPV virus. So if you have any further questions, just email me at msuter@suterdds.com, or you can send me information through Facebook like you have. I really enjoy getting your feedback, and I hope this is helpful, and I really hope someone sees this and it saves their lives. So have a great night, and happy Fat Tuesday. Bye-bye.